Happy birthday.
Should I smile?
I got that, Raina.
Hello, I am Keela Tinoco, and today I'm going to talk to y'all about something that's very important to me and it's dear to my heart from experience in working in the medical field. Per the American Congress of Obstetricians and Gynecologists, cervical cancer is one of the most preventable cancers today. In the past 30 years, the use of the Pap test has successfully reduced cervical cancer by up to 50% in women. Per the U.S. statistics of breast cancer, in 2013 alone, an estimated 232,340 new cases of invasive breast cancer were expected to be diagnosed in U.S. women. That is a whole lot of breast cancer. Today, I'm going to talk to us about the importance of having a yearly well woman exam. I'm not going to ask y'all to do this, but if I were, I wonder how many of us could raise our hands and say that we get our yearly well woman exam. Just think about that for a second. Today I'm going to discuss what a well woman exam is, why it's so important, and what happens during a well woman exam. I'm also going to talk about the risk of not getting your yearly well woman exams. Most of the information I'm going to talk to you about today came from the ACOG website, which is the American Congress of Obstetricians and Gynecologists. A well woman exam is an annual screening exam of breast and gynecological issues and diseases. It's recommended that women start their well woman exams at the age of 13 to 15. I know that sounds really young. These young exams are mostly to get your daughters or yourselves comfortable with going to the gynecologist. They're for counseling purposes. A lot of times your daughters are scared to ask you something if they have problems down in their areas or whatever, but they might feel more comfortable asking a doctor. It is recommended that we get these done yearly, as uncomfortable as they are. And when you turn 40, they recommend mammograms added to that every 2 years. And they're so important because they're a fundamental part of our medical care. They're also valuable in preventing diseases because you're getting it checked, so you're getting it caught early. It recognizes risk factors for disease and it identifies medical problems that you might not even know that you have personally. It also builds and strengthens your provider-patient relationship. Breast exams are based on age and risk factors. That's one of the main things that's going to happen during your well woman exam. Also, starting at the age of 21, they will include a pelvic exam in your well woman exam, which is a pelvic exam plus a pap smear, which is a sample of cells of your cervix that they send off to test. They will also do lab work and screenings of STDs if you think you might have that. Hopefully none of us ever come across that. They will also do counseling of any kind of female issues that you have related to a whole spectrum of health problems that us women face that men don't have to face. There are several risks involved in not having a yearly well woman exam. Some of the major ones are having your uterine and cervical cancer go undetected. And if you're not getting a well woman exam done, then you're not getting these detected and you're not getting treated ahead of time. You can also have a serious risk of side effect of STDs. Some women have STDs and don't even know that they have them until it's too late and they've had serious health problems because of it. Also, undetected breast cancer. If we're not doing our self-breast examinations every month, we could have breast cancer for years before we ever even know it, so it's very important that we see the gynecologist every year. Also, HPV can go undetected. HPV is a human papillomavirus that can lead to cervical cancer, and these viruses show up on pap smears, and so then you can be treated and have your cervix treated so you can get rid of the HPV. I used to work for a gynecologist, and I remember a young girl in her mid-20s. She was underinsured, no doubt, sexually active, and she had not been getting her regular pap smears and her well woman exams. She had some years probably back, even maybe when she was a teenager, contracted HPV, which is the human papillomavirus. That virus can transpire into cancer in a year, but it usually does not happen that quickly. She finally came in for a pap smear, probably because she had an STD and wanted to get that treated as well. Her results came back that she not only had HPV, but she had cervical cancer. And I'll never forget that we had to call and give a mid-20-year-old the news that she had cervical cancer and had to start undergoing cancer treatments. So getting yearly well woman exams is very close to my heart. I will never forget that. It is something that can save your life, and it's very, very important. If you're underinsured, you can contact your free clinic to get it. If you're insured, contact your gynecologist. Get one scheduled today. Thank you all for coming.